Good morning, everyone. I'm Bill English. I'm a professor in the finance group at the Yale School of Management. And welcome to this COVID-19 faculty panel. This is one of several faculty panels we're organizing on COVID-19 issues. This one is on policy perspectives. And I welcome you to this panel. I welcome students, faculty, and staff, as well as alumni and friends, and all of our new colleagues from the Broad Center. We're looking forward to an interesting session this morning. Let me start by thanking our colleagues in SOMIT and Media Services for making this session possible, and also for helping so much with all of our online teaching since spring break. It's been, as you know, a complicated time and a big effort to move online with all of our teaching, and we're very grateful for the help that we've gotten. I have three tremendous faculty colleagues with me today to discuss a range of policy issues related to the COVID-19 crisis. So let me introduce each of them to you. First, we have Andrew Metrick, the Janet Yellen Professor of Finance and Management at the Yale School of Management, and also the head of the Yale Program on Financial Stability. Andrew earned his PhD at Harvard and then taught at Harvard and the Wharton School before coming to Yale. He served at the Council of Economic Advisors during the previous crisis. I guess we have to talk about it now as the previous crisis. And he's done pioneering research on the causes and consequences of the financial crisis. The Yale Program on Financial Stability has been gathering information on the tools that have been used in past crises in its New Badget project. And it stepped up recently to gather a detailed list of the many steps that have been taken to address the effects of COVID-19. That list, the COVID-19 Financial Response Tracker, now has more than 2,000 specific items on it with information on each. So if you want to follow the policy response to the crisis, you know where to look and you know who to thank. So welcome, Andrew.
Thank you, Bill.
Second, we have with us Fiona Scott-Morton. Fiona is the Theodore Nuremberg Professor of Economics at the School of Management. She received her PhD from MIT and started her academic career at Stanford and the University of Chicago before coming to Yale, where she's been on the faculty since 1999. She served as Deputy Assistant Attorney General for Economic Analysis in the Antitrust Division of the Department of Justice in 2011 and 2012. Fiona's academic research is industrial organization, with a focus on empirical studies of competition. Her published articles range widely across industries, from magazines to shipping, pharmaceuticals to internet retailing, and all published in leading economics and legal journals. The focus of her current research is competition in healthcare markets and also the economics of antitrust. So key issues for our panel today. So welcome, Fiona.
Thanks, Bill.
And finally, we have Sigga Benediktsdottir from the Jackson Institute of Global Affairs at Yale. Sigga received her PhD from Yale University, and the two of us were then colleagues for a time at the Federal Reserve Board in Washington. But following the Icelandic banking collapse in 2008, Sigga was appointed to the Parliamentary Special Investigation Commission on the causes of that collapse. And then she went on to be director of the Financial Stability Department at the Central Bank of Iceland from 2012 to 2016. And remarkably, but these are Nordic countries, they get along. She was also a member of the Danish Systemic Risk Council over that period. Happily, she then came and joined us at Yale. So welcome to you, Sigga.
Thank you very much.
So thanks to all three of you for participating today. Let me talk for just a moment about the format for our session today. I'm going to start by asking the members of the panel to provide some opening remarks. By pre-arrangement, the topics are going to be Andrew first on fiscal policy issues, then Fiona on the implications of this event for healthcare markets and Medicare for all, with a kind of a sidetrack to the procurement of COVID-19 tests, so an issue we've all become unexpectedly interested in this spring. And then I'm going to use my prerogative as chairman to put myself in the lineup to talk about monetary policy issues. And then Siga will finish our go-round with a discussion of regulatory issues and particularly macroprudential policy issues. After those remarks, we'll have some discussion, and then I'm going to open the floor to questions from all of you who are here today. Please use the Q&A feature at the bottom of your Zoom screen to submit questions, and some of our media services colleagues will be forwarding the questions to us, and that will give us more to talk about. So with that as background, let me turn to Andrew. You're up.
Thank you, Bill. Bill, can you hear me? I hope if you
I can indeed. Yep.
Great. Good morning to everybody. I hope everyone is staying safe and you and your families are well. I'm tasked with talking about the fiscal side of things, and I want to start with a little bit of an overview of the whole overarching policy perspective, economic policy perspective on the COVID-19 crisis. The most important thing to remember when you're looking at any of the policy responses is that the fundamental big picture macro problem we have is that whether or not governors and presidents and prime ministers order a shutdown, we're going to have very decreased economic activity, probably at least until there is a vaccine or a very, very good treatment, which might be quite some time. So collectively, we are going to make, as a society, we're going to make less stuff. Having a lower GDP means we're going to have less, we're going to make less. So we're going to have to consume, unless it's buried in the ground somewhere, we're going to collectively need to consume less. The issue there is if we all had to consume 5% or 10% less, or even 20% less, we could probably do that. But the burden doesn't fall that way. There are some people whose livelihoods have completely disappeared. And there are other people who who are busier than they've ever been. And then there's some who can basically do their jobs and get paid almost the same. So the main problem that we, as a society, and this is true within the United States, and it's true it's true across the world, is how do we handle this? How do we share this burden, share this risk? Let's say that it's 10% lower GDP, which means, imagine that means 10% of the people getting nothing and 90% where they were before, as an extreme example of that. How do we manage to share and keep people from real suffering during that time? That's ultimately a political problem that will be solved mostly through fiscal policy. And so we have to politically decide, how can we transfer from people who are still basically doing okay to people in great need? Within the United States, that manifests itself by different regions of the country and different industries. But then across the whole world, it will be manifesting itself enormously in differences between the developed world and the developing world. So with that big picture in mind, I think you can think about the response, the economic response to the crisis in 3 phases. The first phase is really rescue. So trying to make sure the house doesn't burn down, that the patient doesn't die, all that kind of stuff that you see in the medical world and in the firefighting world, we're seeing it here. In the United States, the response was a $2 trillion plus piece of legislation to try to get money out into the hands, resources into the hands of the people who most need it. Overall, the way that we're going to do all of these phases is, if we can solve the political problem, which of course going on at the same time, it's an engineering problem to do it efficiently. And for rescue, you're really just trying to save the patient. A lot of the rescue activities done by the central bank, and Bill will talk about those when it is his turn. But some of the most important aspects of what the central bank did came with a backstop from the fiscal authority, which is how it should be. So a fairly large chunk of the CARES Act was used to backstop Federal Reserve programs. So that's the rescue phase. And I would say we are just as it is in the health crisis, where the curve seems to be close to being flattened. We're about the same place on the economic side and ready to move to second phase, which I would think of as stabilization. And to understand what we need to do in stabilization, you need to look forward to the third phase and work backwards. The third phase will be recovery. Recovery when we need to actually get everybody back to work, and get the economy humming to the place that it was before COVID-19. Recovery can't happen, again, until we have a vaccine or really, really good treatment. I just don't see a world where people my age and older are going to be willing to go out of the house and spend the kind of money and do the sorts of things that they did before COVID-19 until that exists. So governors can open up all they want, but I'm not going to a movie theater and I'm not going to a restaurant, and neither are a lot of other people my age and older. So until we have that vaccine, we're going to be now in this stabilization phase. And I think the goal of the stabilization phase, if I were trying to be a benevolent social planner about it, would be to make sure we get money into the hands of the people who would need it the most, who would be most desperate, and also to make sure that we don't lose crucial infrastructure along the way. Having work relationships destroyed, having companies go out of business, having the banks run out of capital, all those things can happen during our phase until we have a vaccine, and we have to pay attention to it. Finally, in the last phase, it will be more traditional macroeconomic stabilization policy and stimulus. It's been called stimulus so far. It's not stimulus. That's not a good word for what we've done so far. What we've done so far is rescue. Stimulus is where you think there's not enough aggregate demand and you want to get it going by giving some people money that they'll go out and spend. Now we're giving some people money so that they can eat. It will come a time post-vaccine where we will look at the infrastructure we have and have to figure out just how much can we still afford to do to try to get the economy going again. Okay, I think I took more than my fair share of time, but I will stop now.
Okay, well, thanks very much, Andrew. That was great background for this. So let me turn now to Fiona, please.
Thanks, Bill. Let me start with procurement of tests, because I think that's something that's just in the newspaper every day. And I think it's pretty straightforward to understand once you realize a few things, but it's not explained very well in the media. So in the United States, we rely on the private sector to deliver a lot of healthcare products, including things like tests. Okay, commercial companies start themselves, they invent a test, they get it approved by the FDA, and they manufacture it. If you're going to rely on the private sector in a pandemic to supply a test, then you need a strong understanding of the financial levers you're going to use to get those testing companies to supply. So for example, the Medicare payment until last week for a COVID test was about $50. Is that above or below the cost, the marginal cost of producing that test? Apparently, the marginal cost is around $200 to $250. So a hospital running a test loses money. That means the hospital's not really incentivized to do more testing, even if entrepreneurs or companies offer them more tests. But even if you raise the price of Medicare and even if you said we want all commercial payers to pay $250, the marginal cost of the test is not really relevant. We want to scale up testing by a factor of 100 or maybe even 1,000. So who's going to pay for the increase in capacity? Let's think about that. The machines that are very large that can run lots of samples at once cost millions of dollars, let's say $10 million. That's only part of the problem because there's reagents and a long supply chain of getting the bacteria from the vent under the sea where it's millions of degrees and all the different specialty chemicals and so on that go into that supply chain. That's more millions of dollars. So imagine I'm an entrepreneur thinking about supplying these tests. I'm going to spend $20 million getting set up, and then there's going to be a treatment in 4 months, a vaccine in 8 months, in 18 months, okay? It's going to be extremely challenging for me to recoup all those millions of dollars in the amount of time in which I'm likely to be selling these tests. So what does the government do in that circumstance? Well, you could try a per test price of $5,000 or something like that. That might leave the government feeling a bit foolish because it could either still be too low or it could be amazingly high and lead to windfall profits for the people who already have a machine. So one solution to this is the Defense Procurement Act, where you say to some company, make the test, like we want 1 million tests by next week, and then you pay their costs. And whatever those costs are what they are. And the government gets the capacity it wants, and nobody's worrying about amortizing those payments over time because the government is paying for those fixed costs of procuring tests. So when people say in the newspaper we have to test more, you should really ask, well, you can't ask the newspaper, but ask whoever it is, like, how exactly do you plan to do that? Who is going to supply the testing? As far as I know, nobody is. We're all talking about we need to test more and nothing is happening. The number of tests in the United States is really not growing. So that's an issue. One of the, backing up a little bit to broader issues in healthcare brought on by the pandemic. One is consolidation. There are many doctors in the community who are not seeing patients anymore, especially if they don't do telemedicine. There's potential bankruptcy and consolidation in physician practices for this reason, with physicians just shutting down their practice and going to work for a larger organization. There isn't so much consolidation in hospitals because we've already had it. We have highly concentrated hospital markets in most cities in the United States, so it's too late for the hospitals to consolidate. They already did. Although rural hospitals are at risk of closing, and there was a recent study of that seems like we may be experiencing quite a bit of rural hospital closure. Devices, we have also had enormous amounts of consolidation over the last 10, 15 years, and that appears to have affected our ability to respond again to the crisis in areas like ventilators and so on. So we're suffering from past waves of consolidation, and we're likely to get more. Broadly, I think what one sees from this pandemic is that attaching a person's health insurance to their employment is a really terrible idea. You get fired because it's a pandemic, and just at the time when you're likely to get dangerously ill, you also lose your health insurance. So I feel that we have a moment for people to appreciate just what a terrible idea that is and how we should be supplying health insurance a different way. We also are seeing that having uninsured people in the population and people with insurance but with high out-of-pocket payments means that people don't get tested and don't go to the doctor when they're sick, and that creates an externality on all the rest of us, right? All of those underinsured and uninsured people are working and infecting everybody else. We also see that our system is very expensive. And on top of that, we see that is incredibly disorganized and can't perform. So we have a very expensive system that doesn't cover everybody, that severs your health insurance when you get unemployed in a pandemic and cannot handle it. So I just am hoping that what this makes clear is that what health economists have known for decades, we have just a terrible system in the United States. It's really bad. And we need some substantial reform. I think this is going to give a lot of momentum to the Medicare for All folks. And, you know, there's lots of different ways to do Medicare for All, but we clearly need something better in the United States in terms of our healthcare organization. I'll stop there.
Thanks very much, Fiona. That was a lot of really interesting questions. Let me take the floor for a few minutes now to talk about some monetary policy issues. This has been just an astonishing time for monetary policy. I was at the Fed for many years, and I've never seen anything like this, even during the crisis. Things have moved remarkably fast. I'd like to think about the monetary policy and central bank response in three pieces, and conveniently, they're basically the same pieces as Andrew was focusing on when he talked about the fiscal policy response. So you start with rescue. In the case of the central bank, that's basically keeping financial markets functioning. So there were big problems in a range of financial markets, and you just needed to act quickly to support the functioning in financial markets. Then the second part, the stabilization part, as Andrew put it, is basically efforts to support the provision of credit to firms and households. So you have firms and households that need to get past a period of very low income, low activity. To do that, they either need transfers, and Andrew talked about that. But if those transfers are not sufficient, they need to borrow. They'll need credit, and so it's important that credit supplies are ample. And then later, in some sense, there's recovery, and at that point, monetary policy, kind of more standard monetary policy. I'm tempted to call it conventional monetary policy, but part of it is now kind of the conventional, unconventional monetary policy. So it's lower interest rates, but also QE and forward guidance and so on to support the recovery once we're past this shutdown period and the economy can begin to recover. So let me speak about each of those just briefly in turn. So the first piece, again, the idea is the immediate shock in February led to a huge marking down of the outlook. And so a lot of investors wanted to adjust their positions in financial markets very sharply. And the problem with that was that the markets just couldn't manage it. You have broker-dealer firms that kind of sit in the middle. They're supposed to be making markets in a variety of securities markets, and their balance sheets got constrained, and they just couldn't manage the flows. The flows were huge, and the firms just couldn't handle that. So the Fed stepped in with a bunch of steps to try to aid in those markets operating. So the problems in markets were very widespread. The most remarkable thing was, for a time, even treasury markets, the deepest, most liquid markets in the world, were really not functioning very well. The amount of transacting was not as high as it should have been. The bid-ask spreads were wide. Liquidity in terms of how much transacting you could do was very limited. And so the Fed had to act. And so it first provided a huge amount of liquidity to broker-dealer firms in the form of repurchase agreements. That's essentially short-term secured financing for the broker-dealers. That was not sufficient. The broker-dealers were not worried that they could not finance holding a big book of Treasury and agency securities as they moved them from sellers to buyers. They were worried about the size of their balance sheets, that they didn't have enough capital for this. And so the Fed ultimately had to simply buy itself large amounts of Treasury and agency debt. So substitute the Fed's balance sheet for those of the broker-dealer firms. It provided additional credit to broker-dealer firms against a wide range of collateral to help them make markets in other markets, corporate securities markets, municipal securities markets, and so on. In addition, the Fed eased greatly the terms at the discount window. That's the standard facility it uses to lend to banks, and has since its inception more than a century ago. And it extended a network of swap lines it had with foreign central banks. The idea there was to provide dollars to the foreign central banks so they could provide credit to banks in their jurisdictions. So a huge amount of credit as part of this rescue operation to keep markets functioning. So then the second step is stabilization, as Andrew said, and there the problem was that there were disruptions in credit markets. Credit markets weren't functioning properly, and the Fed had to step in to either support credit provision by others or simply to provide credit itself. And it's done a range of things on that score. Stepped in to buy, for example, commercial paper of large firms because the commercial paper market wasn't functioning properly. Stepped in to purchase municipal securities, something the Fed has been very wary of doing for a long time because of the political ramifications. You're stepping in, you're buying securities from one state and not from another state. That's pretty awkward. And so there are some real difficult issues around that. The Fed established a program under which it would buy corporate bonds, something again it had not done in the past, and even under which it would buy large shares of new business loans made by banks through a thing called the Main Street Lending Facility. So all of these programs, as Andrew mentioned, are actually kind of a mix of monetary and fiscal policy. The Fed is stepping in, it's providing balance sheet, it's providing liquidity, but it's taking risk. And under the provisions of the Federal Reserve Act, it has to be secured by kind of sufficient security to protect the taxpayer from loss. What that means is the Treasury has to step in and provide capital for these sorts of lending programs. So the CARES Act that Congress passed provided the Treasury with a big bundle of capital, and the Treasury is now providing that capital to the Fed to back these various loan programs, and so those programs help with again with kind of the second step here. The second step being that we want to stabilize the situation and make sure households and firms can survive, can get through this difficult period. Finally, the Fed is also using and will use standard monetary policy tools to kind of ease pressures in markets and support aggregate demand once the economy begins to recover, to strengthen that recovery. So the Fed has already, in two huge steps, taken the federal funds rate back to essentially zero. So it went down to a rate like zero in the financial crisis in late 2008. Rates stayed there for 7 years. In late 2015, the Fed began to normalize rates. Rates had gone up. They came down some last year because of concern about trade and about global growth. But now the Fed very quickly moved rates back down to zero. I think once the Fed has more clarity about where the economy is going and what the outlook is, it will then use the tools that it developed once interest rates got to zero following the financial crisis. That's forward guidance about what it intends to do with the federal funds rate over time. How long will it stay low? And then also large-scale asset purchases, purchasing longer-term Treasury and agency securities to push down term premiums, push down longer-term rates, and boost aggregate demand for, say, houses and autos and things like that. I suspect they'll wait a little bit more time to get some clarity before they try to do that, but we'll see. There's a policy meeting next week. I've been surprised by how fast the Fed has moved. I may be surprised again next week, but it'll be interesting to see. In the interest of keeping things short and answering your questions, I'll stop there, but we could talk later about escalation options, kind of what would the Fed do, what more could it do if it needed to do more. But let me stop there and turn things over to Siga, and Siga, take it away.
So this is first and foremost, of course, a healthcare crisis, and we will not see full recovery of the economy until we have solved the issues there. But at the same time, we cannot all think about just the healthcare and how we can provide tests and things like that. So my field is more financial stability. And I just wanted to start by reminding people that, for example, the global financial crisis started in July 2007, but really didn't hit really hard until the banks started to falter, either in March 2008 or in September 2008, which we all remember it was when Lehman failed. The same thing happened in the Great Depression. Everybody talks about 1929, but really the depth of the crisis started in 1931 when banks started failing, and the failure of the banks created prolonged crisis and prevented any kind of recovery. So what we need to do now is to prevent these healthcare crises from morphing into a financial instability or financial crisis or banking crisis. And that is something that all central banks, regulators, and even some other policymakers have to have in mind at the same time as they're, of course, first and foremost, trying to solve these health care crises that we have in front of us. And it's been quite interesting to see what has happened. I want to start by talking about first international flows and emerging economies. We've seen huge amounts of funds flow out of emerging economies. Their currencies depreciate due to the fact that there's flight to safety. So basically money is flowing into the US and out of these emerging economies, which are seeing their currency depreciate 20–25% at the same time as they're trying to solve these healthcare crises. And like Bill pointed out, the Federal Reserve has actually stepped up and both had swap lines with the major other central banks in the world and also offered to take treasuries for repurchasing loans to these economies to try to stabilize currencies and stabilize their economies from that perspective. In addition to that, if you just go into the banking sector, what we need to now is to support the banking sector in being able to give forbearance or potentially more loans, like Bill English pointed out, but at the same time not destabilize the system as a whole, because we needed to support us in the third stage of this crisis, which is going to be the recovery, like Andrew Metrick pointed out. So what has been done is actually quite a lot and much faster and much more than in the global financial crisis. And I think the biggest tools that we've been seeing central banks and regulators use for the banking system to support it, they have been, number one, lowering capital requirements. So if they've had some kind of cyclical requirements on their capital for banks, they've lowered that, and mostly to counter increased loan losses that the banks are now accumulating. So what happens in the banking books when we see crises like that is they will have to put a lot of money into loan losses. And just as an example, JP Morgan, that has capital ratios of a capital of 185 billion, increased its loan loss provisioning from $1.5 billion to $8.5 billion just for the first quarter of this year. And this was a 30 to 40% increase in the loan loss reserve account. And this alone can fast destabilize banks that don't have a big capital cushion. So it's really, really important to give banks the leeway that they can basically run their books in such a way that they are prudent, but at the same time not breaking capital rules in this kind of environment. Second, what we saw is that a lot of regulators and central banks also loosened liquidity rules on the banks. They did it from both sides, both increasing access for banks for liquidity, increasing even the amount of assets they would consider as liquid assets, and even some countries went as far as lowering liquidity requirements for the banks, saying they could operate below regulatory requirements over this period due to this uncertainty that's happening. Then everybody realized that we are going to have to actually almost put the economy on pause. That means that basically banks are not going to be getting paid for loans over some period, 3 months, 6 months. This is usually something bank can easily withstand as long as the loan is still performing in other ways and will be paid up at some point in the future. So a lot of regulators have also said that if banks have the capacity, they can actually pause loan payments, and that will not be considered to be forbearance, and we will not have to put more money into loan loss accounts due to that. And this is a huge leeway, and I've never seen this done before like this economy-wide for banking systems, and this has been done all over. I would say that the central bank in the world that has been on the forefront of these crises is Bank of England. And at the same time, other central banks have been watching very closely what they've done, and they've followed it 1, 2, 3 days later. But definitely Bank of England has been at the forefront of this. And they've even gone so far as to say that listed companies on their exchange, they put a moratorium on them putting out expectations about how their profits are going to be due to the uncertainty of at this time. So they feel like any kind of an announcement from a listed company is going to just increase variability in the markets and not give any kind of information. So it's very, very interesting to see what's being done. And I think, even though as you can see, I'm a little passionate about it, I think it's superbly important that these crises will not spread into a financial instability, and the banking system and the financial system as a whole will be ready to support the recovery that is going to come, since our production possibility is still here. That is not being ruined. So as soon as we get these health crises under control, then we can start the recovery of our economies. Thank you.
Okay, thanks so much for those remarks, Sigga. I guess I was interested in following up on a couple of issues here. One issue for Fiona. So you gave us a lot of information about consolidation as one of the broader issues about our healthcare sector. And it wasn't obvious to me, why is consolidation necessarily a bad thing here? Is it that it reduces the kind of cushion of capacity, or What is it exactly about consolidation that has you worried in this particular situation?
There are some kinds of consolidation that I would not be worried about. So for example, if you've got a physician practice with 2 or 3 people in it, that is inefficiently sized, and those were going away anyway, because larger practice groups can handle the software costs of keeping data secure and so on. But one thing we are concerned about is large healthcare groups that exercise market power. And that market power is held in check by having competitors. And in particular, competitors that could be smaller and therefore are not exercising as much market power themselves. So if you have the smaller groups folding or being bought by larger groups, then you're increasing concentration in that industry and you're going to expect higher prices in the future. And to the extent that we just have rising market power in all sectors of our healthcare economy, we are heading toward Medicare for all, because at that point, an individual buyer can't bargain, can't leave to buy from anybody else because there aren't choices. And so you end up saying, okay, we'll have the government just bargain on behalf of everybody and set a price. So I think it's somewhat short-sighted for healthcare providers to consolidate to obtain market power because there's an externality on the regulatory regime, but they don't think like that because they're managers who want a bonus next quarter or whatever. And so we've been headed in this direction for some decades now.
Is there a view that in the current situation, having some market power or some kind of joint activity is helpful in an emergency because you can scramble more resources to address the problem?
Not the kind that's collusive in general. There have been some very nice instances of cooperation that nobody would think are anti-competitive, like Connecticut hospitals sharing COVID patients so that empty beds get filled and there aren't patients without a bed. Okay, that kind of thing is cooperation and it's marvelous. There was an earlier question about should vaccine makers get together and collude in light of chasing a vaccine. And one of the things you need to think about there is the diversity of innovation. We don't want everybody talking to each other and then only pursuing 3 ideas when there were 10 of them and they were going to pursue 10 ideas, because of course finding a new treatment is risky and you want lots of different paths being pursued by lots of different firms. So that's one reason not to have this kind of consolidation also.
Okay, thanks so much. And I had a question for Sigga too. Actually, 2 questions, but the first is, should banks be paying dividends now? I've been surprised a little bit that in the UK and in Europe, banks have been basically told don't pay dividends. In the United States, not so much. Indeed, some regulatory changes were made to allow banks to continue to pay dividends. How do you feel about that? It seems to me it's just allowing capital to go out of the banking system at a time when we're going to need capital in the banking system. Are there reasons for that, though?
No, I don't see the reason. I think there are some Americans that see reason for that, but I definitely think dividends should not be paid at this time. Buybacks and dividends should neither be done at this time. So one of the things that have been done here in the US, they have postponed the application of expected losses in the accounting of banks, and basically allowed them to therefore add to their capital a very weak kind of capital form, I would say, which is basically their loan loss reserves due to expected future losses. And the fact that banks are paying dividends at the same time as we have this weak portion of their capital, I just don't think is prudent at all. And should have been, in my opinion, as you are loosening capital requirements in such a way and postponing new regulation that are considered to be prudent, you should at the same time have some requirements on the other end. This is not just a give and not a take. We really need these funds to be used against loan loss reserves and also against potential lending once we get into the recovery stage.
do you worry, Siga, that the regulatory kind of forbearance that's been put in place to help banks manage the coronavirus losses could go too far, that we could end up, in a sense, weakening banks that maybe should be out now, raising capital or being more cautious in their behavior in order to preserve capital so that they won't themselves become a source of weakness later on if the downturn is protracted.
So now you're basically asking me if I'm microprudential supervisor rather than macroprudential. A lot of these things were put in place just with the view of being able to relax it if we got into a crisis. And in my opinion, if we're not in a crisis now, I don't see when we are in a crisis. We are seeing huge percentages of borrowers asking for some kind of forbearance. And if this is not a crisis where banks should be allowed to draw down on their capital, draw down on their liquidity buffers, I do not see when that should be. And therefore, then the whole system would have failed for us. This is actually even a test of that. If we don't have the stomach to see their capital decline, if we don't have the stomach to see their liquidity decline, then we are basically saying that we don't have the stomach to have these institutions be counter-cyclical. And we still want to have them be pro-cyclical and actually amplifying both shocks and booms. And that is something we do not want.
Okay, thanks very much. And Andrew, a question for you on fiscal policy. So the CARES Act was about 10% of GDP. It was pretty big. Looks like there'll be another pretty big act soon, and people are already talking about another one after that. We could end up with 20% of GDP or something like that this year in fiscal action. Do you worry that the debt to GDP ratio could get just too high? And so is there a constraint to what the federal government can do in this crisis?
Most certainly there is a constraint. There'll be a point where the debt to GDP ratio in the United States would be so high that people will start to wonder about the sanctity of U.S. government debt. I don't think we're near that now. I think that we've got quite some room before that would happen. That's not to say that it's free. Taking up some of that capacity, using some of that room means you can't use it later. But if you look at the debt to GDP ratio of Japan, it's something like 250%. So I don't see why we couldn't support the same levels that Japan manages to support without causing people to wonder whether our debt is actually going to get paid back. But of course, since you will run out of room at some point, using some of the capacity now, it has that cost. I think it's not even a close question. We do need to use it now. We would face a massive humanitarian crisis even in this rich country were we not to engage in an enormous amount of rescue spending. So I'm not worried. I'm not worried in a short-term kind of a way, and I think that the calculus is clear that we should be doing.
Okay, thank you. So before I open it up to our audience, do any of you have questions for each other that you want to raise before I turn to the questions from the audience?
Nothing from me.
All right, so we have some questions from the audience. Let's look at those then. So Andrew, I think this one's for you. Sorry. Mitch McConnell's, on its face, Mitch McConnell's statements don't, to not subsidize state budgets and instead allow them to use bankruptcy seems cruel and dangerous. Is there a reason why this bankruptcy approach might actually be a good idea?
So a little background here. The question as stated is accurate, which is that the Senate Majority Leader has come out and said, effectively, he doesn't want to be subsidizing, he doesn't want to create a blue state bailout and subsidize states and those states paying rich pensions. Instead, those states should just declare bankruptcy, and that would be a better way to do it. So I'll start by saying, and the way that I began is, remember that a lot of this is just going to be how we share the burden, and politicians on all sides are going to be looking to have the burden not taken up by their constituents and taken up by others, and that's unfortunate but true. And in this particular case, I think Mitch McConnell is saying the quiet part out loud by saying, I don't want this to be a blue state bailout. He doesn't want to see any federal money going to states that don't vote for his party. And that's unfortunate. We have a lot of automatic stabilizers in the United States, and for the most part, the automatic stabilizers move money from so-called blue states to red states. And it's good that it happens behind the scenes, because I think what makes a federal system work is when people don't get angry at each other, but instead help out in these cases. But on to the specifics of this and the mechanics of this. The first thing to note is that states cannot declare bankruptcy. So it's actually not legally possible. The Congress would need to reform the United States Bankruptcy Code to allow states. Cities can, but states cannot. Furthermore, even if Congress did change the bankruptcy code, there are other legal impediments that prevent states from declaring bankruptcy. But let's just set that aside for the moment and just imagine that instead of declaring bankruptcy, what he really means is we're not going to send any money from collectively from the country to places to some parts of the country because we don't want to, and then ultimately those places will have to bear the burden. So let's think about what that would mean. There still will be a transfer. The transfer then would go, instead of collectively from taxpayers, it would go to whoever the state is unable to keep its contracts with. And that would be some combination of its bondholders, which are from all over the place. And to a large extent, the pension and healthcare retiree benefits claimants in those states, which are the largest liability that we really will be unable to pay. So that's a pretty strong statement. That's a statement that's saying instead of taxpayers in general paying for this, it should come out, of those groups. We have a lot of problems with the way those contracts were written over time. I share people's frustrations with that. I don't know if a crisis is the right time to be cutting off retirees. It seems like it's worth having a conversation about whether we should reorganize some of these obligations. But to do it in the midst of a crisis seems like it would be bad policy, leaving aside whatever you think about whether it's the right or the wrong thing to do. I think it's a bad policy. It's quite regressive in the midst of a crisis. So I'll leave it there.
Okay, thanks so much. Fiona, a question for you as our medical director. Given the current situation in the U.S., what is the likely time when the curve starts to flatten? The time frame also affects the education sector, and schools will need to decide when to reopen or suspend in-person teaching for the upcoming fall semester as well. So what do you make of that?
When will schools reopen? And by this, I think the person means universities and colleges. I will say that we just don't know. There's so much uncertainty about September that it's really not productive to speculate. I can tell you, having a few of this demographic in my own house, that they would like to go back. Deferring college makes no sense when you can't get a job and when you can't travel and when you've been living with your parents for several months already and your younger siblings. So these are students who would like to go back. We also have major capacity problems at universities. If we skip a year, we then can't just squeeze twice as many people in the next year. It doesn't work like that. So it's going to be very costly for students not to return to campus. So I really hope we can find a way to do that. But I think it's just way too early to speculate. There are, questions about testing, questions about vaccines, questions about treatments, about whether we can control the virus in certain geographies and so forth.
Okay.
There's a couple more on health.
Yes, why don't you speak to those if you would?
Yeah, so a couple of people want to know about what's the most pressing thing to do. I think that activating the Defense Procurement Act and getting some test supply chains built and ready to go seems most pressing to me. I think we can't really defeat the virus until we have the ability to know how prevalent it is in the community and who's already had it and who's sick and so forth. So that seems like something we should have done the first week of February, but certainly could be done now. In terms of the longer term health reform, how do we, as somebody famously said, don't let a good crisis go to waste. How would we use this to reform the way we deliver healthcare in the United States? I think if you're a Medicare for all person, what you might want to do is say, look, anybody who's unemployed gets to join Medicare. They're just automatically enrolled in Medicare. Anybody who's a healthcare worker who's uninsured is going to go into Medicare, and anybody who's in a high-risk group for this virus, namely over 50, goes into Medicare. And if you did something like that, you would very quickly have a large share of the population being covered by Medicare. And by the time this thing is over, people might decide that they liked that and wanted to vote to keep going. I, prior to this crisis, had been thinking maybe the better thing to do was to put a public option on the exchanges that was Medicare, basically put Medicare on the exchanges for people to buy. But one of the things that's true about having a more unified system is that when you decide as a country you're facing an epidemic and everybody needs to do X, okay? If you have one system, you can require X and the next day it happens. And in the fragmented system that we have now with people buying different plans on an exchange, it's just much harder to do that. And if this is going to be an ongoing threat to our country, because these viruses will appear every so often, we need to be able to be better organized. And I think a unified system where you can say all of these certain kinds of people should be tested this week or something. I think that's going to have big payoff for us in the future, and we might want to move to an organizational structure that lets us do things like that.
Yes, a question on that for you is, does the Medicare system have the bandwidth to take on a huge number of additional people? How would that work exactly?
Well, remember, it's all the same people and all the same healthcare. And what we're doing is spending 50% more in commercial rates than we do in Medicare rates. So when people say we can't afford Medicare for all, they're confused. They're thinking about dollars that private people pay or forego instead of wages as being different from dollars that they would pay to the government to provide them healthcare. And those are the same dollars. We know that. Those are fungible dollars. So we have enough healthcare resources in this country to treat everybody. We just don't because we have some uninsured people who don't go to the doctor, and we have some, we probably have a little bit of a shortage of primary care because we pay less in primary care and we pay too much for specialists. But if we rebalance that, we have enough physicians, we have enough capital, we have enough hospitals.
Okay. There's a question here, I guess is for me, asking about, I think perhaps the idea is modern monetary theory and kind of the ability of the Fed to provide finance for the Treasury if the Treasury is running large deficits. I was going to talk a little about that when I got to escalation options, kind of the nuclear option in some sense for the Federal Reserve is to provide finance for the Treasury. So if the Treasury is running large deficits, Andrew's large deficits to deal with the COVID-19 crisis, the Fed could step in and could simply finance those deficits by crediting the Treasury's account at the Fed, and the Treasury would then spend the money, and that's feasible. It would require a change in the Federal Reserve Act to do that, but you could do that. But the way monetary policy is implemented now through interest on reserves, it actually may not help unless the Fed also changes its monetary policy intentions going forward. So in effect, the Treasury is borrowing from the Fed is borrowing from the banks by having the banks hold reserves on which the Fed pays interest. So I think to really get big effects here, the Fed has to simply announce that it is going to finance a Treasury deficit with inflation. It will push for higher prices and higher inflation. And that higher inflation will, over time, basically reduce the obligations of the Treasury enough that the Treasury doesn't have to raise taxes later on to pay for the borrowing that it is doing now. That would be a striking step. It could be very powerful. I think it could also be really confusing and potentially do some harm in terms of consumer and business confidence about the stability of the dollar and the stability of the U.S. financial system. But it is, I think, an extremis a possibility. In Japan, the Bank of Japan, for example, has announced that it's going to keep the 10-year government bond rate near zero for a long time, and that it's going to aim to exceed its 2% inflation objective persistently. So it's aiming to generate significant negative returns on government debt. And that actually does create some fiscal space. So the fiscal policymakers can do a bit more than they would have otherwise. I think Japan has done more fiscal policy than they would have done otherwise. So there is something to monetary fiscal cooperation, even if you don't go as far as monetization. And in an extraordinary crisis like this, something like that is, I think, possible. Though it makes me a little nervous because it could undermine the independence of the central bank and lead to bad monetary policy later on. But that's at least something that we could think about.
Siga wants to chime in, I think, Bill.
Oh, I'm sorry. Siga, please.
Yeah, so a couple of weeks ago, the Bank of England actually announced that they would open up the overdraft account for their finance ministry. They did try to put both on suspenders and a belt because they said this was a very short-term issue. Both the borrowing by the government should be short-term, and the window that they were allowing this was also short-term, just connected to this COVID. But that, of course, means that the government now has direct access to their account at the Bank of England to draw on. The feeling was, though, that it's because the budget is just going up so fast and they are spending so much money, they don't want to increase the issuance of short-term borrowing and long-term borrowing by the same extent. So it's rather to take the variance or the changes rather than just fund directly all of these actions. I also want to point out that in Indonesia, the government there is actually requiring the central bank to purchase initial public offerings of government bonds, which is same, direct lending to the government. At least what I knew a couple of days ago, they were still resisting that at the Central Bank of Indonesia. But definitely we are getting the push for this, that the governments are trying to access directly funds at the central banks. Some central banks trying to stand against it, others not.
On the Bank of England, it maybe makes them a little more comfortable in the sense that they did this once before, right? During the 2008 crisis, the government was able to borrow directly from the Bank of England, and they then worked off that they, as you say, they were kind of smoothing out issuance, and the issuance later on was used to pay down the tab at the Bank of England. And so having done that once, they may feel a little more comfortable doing that again. In an emerging market economy, it may feel a little bit more risky that you don't know whether the central bank, whether the government will be able to borrow later on and retire that borrowing from the central bank. But in the case of the UK, it was clear they'd be able to, so long as the political will was there, and they have at least one case they can point to.
Which they did in the announcement.
That's right. I think our time is about up. Do any of the panelists have a final word that they want to give?
This was really fun. Thanks for organizing, Bill.
You're welcome. It was great fun for me as well. So I think I'll bring us to a close. Thanks to Andrew and Fiona and Siga for serving on the panel, and thanks to everybody who participated today. It's been a real pleasure to interact with many members of the Yale SOM family, and the panelists and I wish all of you well in this crazy and difficult time. So keep washing your hands, and I hope I'll see you all back on campus before too long. Thanks very much. Bye-bye.
Thank you
Well-
very much. Bye-bye.